In this chapter, we explore the concept of psychological safety within supervision, aiming to understand how it can promote a constructive and supportive learning environment. We'll first cover a definition of psychological safety by Amy Edmondson, and then understand why psychological safety is so critical for various stakeholders. We'll then move on to understand some of the barriers and challenges of creating psychological safety in clinical working environments and how we might overcome these. Next, we cover Tim Clark's theory on the 4 stages of psychological safety and how these map onto the NHS Safer Learning Environment Charter. We then discover the link between psychological safety and accountability for performance for optimum learning, before finally putting everything into practice in some case studies. Amy Edmondson, a pioneer and academic researcher into psychological safety, defines it as a shared belief that the team is safe for interpersonal risk-taking. This is the notion where individuals feel empowered to ask questions, admit mistakes, or voice concerns without fear of negative repercussions from their team. Within the context of supervision, this means that learners can bring their whole authentic selves to work, can actively seek feedback, admit when they don't understand or have made a mistake, voice concerns about their placement, or speak out if they have patient safety concerns, without fear of any negative consequences. Pause for a moment to consider why this might be important in supervision and which stakeholders it might be important for. Psychological safety is critical for all in the context of supervision. Firstly, our learners need to feel safe in their learning environment, to be themselves, to experiment and take risks, and to feel no shame in reporting when they don't understand something or need more clarification. We want our learners to actively seek out feedback and critique so that they understand how to make progress and improve. If we think about the negative effect on learners if they don't feel psychologically safe, then there will be higher risk of making mistakes, greater stress, and higher likelihood of burnout. In the context of teamwork, psychological safety creates an environment where team members can be creative, can work together productively, and where all diversity of opinions are encouraged. It is in these environments we see safer clinical work, less errors, reduced complaints, and a drive towards quality improvement. Teams who feel psychologically safe also have less absenteeism and improved staff retention. Finally, and most importantly, there is good evidence that psychologically safe clinical environments lead to improved patient safety and improved patient outcomes. Clearly, creating a psychologically safe learning environment is mission critical for educators, but this is not necessarily easy within the complex NHS system. There is inherent risk working in a clinical environment and factors which can make these environments psychologically risky for learners. Take a couple of minutes to consider why clinical learning environments in primary care can be psychologically risky and the impact of unsafe environments on learners and patients. So, what did you come up with? Here are some of the common barriers we come across in clinical learning environments. Within hierarchical healthcare teams, individuals in more junior positions often find it difficult to speak up against the status quo. As supervisors, we have a dual role of supporting but also assessing our learners, and this tension could be a barrier to true psychological safety. The age-old problem of high workloads, insufficient time, high staff turnover, and high stress clinical environments where the stakes are high and expectations from patients are high mean everyone is under pressure and may find the conscious and deliberate effort to create psychological safety more challenging. Finally, our teams are now more multi-professional than ever and spread out across practices and PCNs, with many working remotely, making it harder to include and support these learners. Critically, we can all hold unconscious biases which can influence our behaviour and risk marginalising individuals, so we must actively examine these and ensure we are promoting a diverse and inclusive culture. Timothy Clark, a social scientist and author, developed a framework on the 4 stages of psychological safety. He argued that there is a universal pattern and natural progression of human needs in social settings in the context of learning. He describes 4 stages, each building sequentially on the last. The first is inclusion safety, the basic human need to connect and belong. We must feel accepted, respected, and able to bring our whole selves to work to begin to feel safe to share our own perspective. In the second stage, individuals feel safe to engage in learning by asking questions, seeking feedback, experimenting, and inevitably making mistakes, but seeing this as an opportunity for growth. In the third stage, contributor safety, individuals feel empowered to use their skills and experience to make a meaningful difference. They are comfortable that they can contribute ideas, take ownership, and be held accountable for outcomes. Here the team is more engaged, motivated, and more productive. The final stage is challenger safety, where individuals feel safe to challenge the status quo. This stage is critical for innovation and improvement, as it allows for constructive debate, challenging assumptions, and proposing significant change. Timothy Clark's model can be simplified to these 4 stages. I belong, I can learn, I can contribute, and I can challenge. NHS England have developed a Safer Learning Environment Charter, which describes what good looks like when developing a positive safety culture for continuous learning. 10 areas are highlighted, with equality, diversity, and inclusion being the golden thread that runs through the Charter. Psychological safety is a core component of the Charter, with Clark's 4 stages all being represented. We begin with inclusion safety and the importance of individuals feeling valued and respected, having a positive identity, and a high-quality induction where they are welcomed into the team and their well-being is prioritised. We then have learner safety, where learners are given the time and space to reflect and process on learning experiences with an experienced supervisor. Their learning needs are regularly assessed, and they are encouraged to seek feedback to develop confidence and proficiency. In the third stage of contributor safety, learners must be encouraged through supervision to take on greater levels of responsibility and accountability as they progress. Clear pathways of communication and flexibility support all learners to fully immerse themselves in the learning environment and contribute their own ideas and expertise. Finally, challenger safety is highlighted, as learners must understand how to raise concerns and must feel empowered to speak up, knowing that they will be appropriately supported. We have already talked about the importance of psychological safety for individuals, teams, and patients. Now, I want to make it clear that a psychologically safe environment is not all about being nice, comfortable, or permitting poor performance. As educators, we want to ensure our learners are continually developing and progressing. What we see in work environments where there is a low degree of psychological safety, but great expectation to achieve high standards, is that learners will feel uncomfortable speaking out for fear of being punished, and this creates a lot of anxiety, which limits learning. If learners are in an environment of low psychological safety, but also low expectation for performance, then they might check out, stop caring, become less productive. This is known as the apathy zone. Where learners do feel psychologically safe, but there is no accountability for their performance or progression, you'll find learners who feel comfortable speaking up and taking risks, but there's a low sense of ownership over outcomes and a low drive for quality improvement. This is the comfort zone. So, the ambition for supervisors and leaders of teams is to operate in this area, which is the learning zone, where there is a high degree of psychological safety and a high accountability for performance and commitment to high standards. It is where both coexist that we see high engagement environment where learning, innovation and excellence can flourish. Let's end with a couple of case studies. Imagine you are a GP supervisor of an ST2 GP trainee. You have a limited amount of protected supervision time, but are asked at short notice due to staff sickness to supervise a newly qualified physician associate. They are not yet confident enough to debrief at the end of your surgery, so regularly need to interrupt your clinic to debrief. How might you create a psychologically safe learning environment where both learners feel comfortable seeking support in these difficult circumstances? What might you include in your induction process to foster a safe learning environment? Next, we have Sarah, the clinical pharmacist. She works remotely for your PCN and has not been able to attend the clinical meeting regularly, as it clashes with her prayer time. She has a concern that patients with CKD are not regularly being offered a statin, but she has not felt confident enough to raise this issue at the clinical meetings she has managed to attend. Instead, she has quietly made adjustments as she has found them herself. How could we create an inclusive learning environment for Sarah? What might support Sarah to feel safe to raise her concerns? There are many different ways to handle these scenarios, and you may have come up with your own valid suggestions. Have a read of these potential approaches to see how they compare to your own. Hopefully the 2 case studies gave you time to pause and consider ways you can create a psychologically safe learning environment in your own workplace. To finish, I'm offering 12 tips for creating a psychologically safe work environment, drawing heavily on work by Amy Edmondson and the paper referenced at the bottom by Hardy et al., which is related to psychological safety in nursing preceptorships, but the learning can be applied to all training health professionals. Take a moment to read through them and reflect if there are ways you could introduce more of these into your own practice. In summary, psychological safety is critical for supervisee engagement, quality improvement, and achieving positive outcomes for patients and safe care. The NHS learning environment can be inherently risky, so as supervisors we have a responsibility to actively promote a safe environment where learners can feel safe to ask questions, seek feedback, and voice concerns. As educators, we must display openness and inclusivity, model fallibility, demonstrate a growth mindset, and take a collaborative and respectful approach to supervision. Finally, a moment of self-reflection on what from this chapter you may want to revisit or explore in more detail, and what you will do differently because of this learning. If you are interested in any further reading, please find below our recommendations of some resources you may find useful.